Good morning, good afternoon, good evening. This is Dr. Garais, BIO117 laboratory. Now, if you look at your, minimize all these other things. If you look at your BIO117 course shell, you look at announcements. There are several things that can help you on your final checkoff and your final lab. And let's talk about your final checkoff. It's right here. Click on it. Now, these are, if you look at your final checkoff, this is how it goes. Of course, we already now know you guys are experts at basic anatomical operations. Can you open it? Can you pick the right cadaver? And remember, for a female reproductive system, you don't pick, you pick physiology, because we are going to look at pregnancy, right? So let's look at what female reproductive system organs you'll be responsible for. Your ovaries, fimbriae, fallopian tubes, the vaginal canal, uterus, be able to identify which part is the cervix, which part is the fundus, which is part of the body, which is the inner layer, the endometrium, and which is the muscular layer, the middle layer, myometrium. If you pick the proper cadaver, it'll be the physiology, Asian female. You should be able to identify the sex of the fetus and use your anatomical powers to, to rotate the view, and so you could confirm the sex of the fetus. And the umbilical cord, might not see it in a certain view, so be able to move the anatomy around using single finger, and be able to identify amniotic fluid and sac, and of course the placenta. If you're asked, then you would be asked to log out of there and then go to choose the male patient. And one or two things I could ask. Male repro, which is the structures of glans penis, scrotum, the vas deferens, also known as your ductus deferens, urinary bladder, urethra, epididymis, testes, prostate gland, and seminal vesicle. These are the most readily seen male reproductive system anatomy in the anatomical system, or the anatomical machine. Or I could ask you to isolate urinary, either for male or female, and then you should be able to tell me which one is the right kidney, which one is the left, which one's lower, which one's higher, and why. Adrenal gland, urinary bladder, urethra. I could ask to look at your internal kidney. I could ask you to cut open and the kidney and identify which one is the cortex or the cortical area, which one is the internal or medullary area. Within the medullary area, you should be able to identify the renal pyramid and the renal pelvis, which is closer to the hilum. You should also know what three structures enter and exit the hilum. The three structures are your renal artery, renal vein, and your ureter. Okay. And that we'll do first, starting at 8 a.m. You'll be called by groups. And once your group is called, you stand outside quietly in the hallway in front of the anatomage lab, and wait to be called. Okay. So that is the well, oops, not midterm, but it's the final lab checkoff sheet. I forgot to change the title. I'll change it for when I print it out, or just cross it off. Okay, and the protocol is as stands. Every one of these items, if you cannot do it, that's minus 10 points. Everyone starts at 100, and for every deficiency, of course, And then right down here, I'll write the total score and of course my initial. Let's look at, of course you'll be responsible for week 1, week 2. There might be a drawing or two in there. And here's your week 1 and week 2 pictures. But let me now focus on the second half, which is out of a 50 item laboratory final, there's going to be like 40 items, which will be mostly identification and pictures, and maybe 10 to 12 medical terminology. And I already have medical terminology summary that you can look at here in your BIO117 quick week 4 notes with diagram. Oh, here it is, medical terminology summary video. So that's everything for the term, and that's anything that I mentioned here is fair game. And it's right here. Now, let's look at week 3 items and what kind of pictures look good. And you know that, of course, what will I do? I'll put this picture and then be able to identify. And I won't use a new picture. I'll use this picture. So be able to identify all structures here. This picture is also nice for internal and external. Okay. And the key to this is here. Of course, your nephron, key to the nephrons here. Now, the distinction here is the Bowman's capsule is number 6. It's the thing surrounding the glomerulus. The glomerulus is the tuft of capillaries, a little like, you know, best way to put it is like dust bunny, like a big clump. Capillaries are here, and remember your nephron is microscopic. You have your proximal convoluted tubule, which is item number 7, distal convoluted tubule, item number 8, and of course here is your collecting duct. Item number 3, this whole thing right here, that is your loop of Henle. And the Henle here has a little bit of tilde, line right here. I could ask you male repro in this view. Okay. The 1 items are note, seminal vesicle is here, prostate is here, urinary bladder here. Of course, ureter coming up and then going to kidneys. All right. It's pretty much very straightforward. You either know it or you don't. Let's look at week 4 notes and diagrams. Now, this is a lovely picture right here. Here's some quick notes. It's nice, it's good, but we already asked these things to death in previous exams and quizzes. But this thing I haven't. Okay, so know these items. Embryogenesis. Here's nice, the 3 different holes. Nice question. Don't worry about Punnett squares because it won't be on this exam. It'll be on your final. And don't sweat it because it'll be like 1 or 2 questions out of 50 questions this Friday. So my advice is, it is Tuesday. Tomorrow is lab. Focus on your lab and your anatomod checkoff. And then when that's done, we'll shift gears and focus on the final exam. Final exam will be held on Friday, July 22nd at 8 a.m. promptly. At 9 a.m. there'll be a generalized overview, but I'm dismissing early. That's how Friday is going to go down. Hey, if you have any questions, kindly email me, and I'll see you in class.